For the pain specialists, some of these complementary approaches are really mainstream for us. We accept them without question. For example, there's a category of complementary approach called the mind-body approaches. Now, mind-body approaches have been part of pain management for 40 years. This includes things like biofeedback, relaxation techniques, distraction techniques, meditation. That's mainstream pain management. We like every patient, if they have the skills to do it, to try to do cognitive approaches to bring the pain down.
Good morning and hello and welcome to the First Coast Black Nurses Association webinar on pain, your mental health and alternative treatment options. My name is Jenitre. I am a certified registered nurse anesthetist who works with patients that experience chronic and acute pain daily. In August, I completed my pain fellowship at the University of South Florida, which gave me great insight into pain modalities that would and could help patients suffering from chronic pain. The fellowship program has allowed me to understand that the treatment of pain is not a one-size-fits-most or a magic pill. Today, there is different aspects for treating pain. Chronic pain contributes to an estimated amount of $560 billion spent each year in direct medical costs, loss of productivity, and disability programs. Pain, one of the most reasons adults seek medical care, has been linked to restrictions in mobility and daily activities, dependence on opioids, anxiety and depression, and poor perceived health or reduced quality of life. So today, I have two special guests to help us understand how mental health and treatments such as acupuncture can contribute to pain relief. First, I would like to introduce Ms. Andrea Besant. Ms. Besant is a public health professional who believes that physical, mental, and spiritual health are interdependent of each other, and that patient education and empowerment are vital to healing. Ms. Besant believes that herbal medicine is simplistic in using food as medicine. Currently, Ms. Besant is a third-year dual degree candidate in the Master's of Science in Oriental Medicine, Doctor of Acupuncture and Integrative Medicine at the college in Berkeley, California. She treats several patients who suffer from acute and chronic pain, and also uses integrative treatments such as prescribing herbal formulas, performing acupuncture with sound therapy and meditation. Ms. Besant research interests includes patients suffering from PTSD, depression, and psychogenic pain. My next guest, Mr. Marilyn Tony Baker, is a mental health and professional counselor licensed in Florida, West Virginia, and Georgia. He is also an adjunct professor, correctional health consultant, author, and wellness speaker. Mr. Baker has years of experience in mental health, substance abuse, and runs a private practice where he counsels teens, adults, and couples. Good morning to the both of you. So good morning, everyone.
Good morning.
All right, so good morning, Ms. Besant. How are you doing today?
I'm doing very well, thank you.
All right, so the first question I have is, could you just kind of explain for the audience what your degree entails, and also tell us a little bit about acupuncture?
My degree, which is a master's in Oriental medicine and acupuncture, as well as a doctorate in acupuncture and integrative medicine, basically entails 4 years, at least 4 years of full-time study in Chinese medicine, integrative medicine, which combines acupuncture, herbology, body work like cupping and massage, and conscious breathing with traditional mainstream biomedicine. And more specifically, acupuncture is the insertion of fine needles into certain points on the body to stimulate a certain therapeutic response.
Okay, so how does acupuncture work in reference to pain? Like, is it just inserting needles, or are there different ways that acupuncture can work? Like, if I'm scared of needles, then can I still get acupuncture?
Yes, you can. There are many patients that I've had before that were terrified of needles. They have either conquered their fear through receiving treatments and acupuncture and realizing that it's really not painful at all. Um, or they choose other modalities like acupressure, which I would basically use my hands to stimulate acupuncture points. There are also contact needling, which is basically, it sounds like a needle when you say needle, but the best description that I can give you is that it is a needle with a blunt tip, like a pin, and you would stimulate acupressure points with the contact needle that does not penetrate the skin. You could also use another modality called moxibustion, which is um, lighting pulverized mugwort herb over certain acupuncture points as well. Um, it does tremendous work with pain for people whose pain is aggravated more by cold. Um, so there are many different options for people to be able to have acupuncture treatments as well as uh, different modalities that we do and still alleviate their pain, even if they have a initial fear of needles, which I would hope to help them overcome.
Great. So also, could you explain a little bit how acupuncture work? I think that a lot of us kind of wonder, like, how does it work with the body and help with pain?
Well, without going into into a lot of description that probably won't make sense to people who don't study the medicine, the basic way that acupuncture works is through either, well, in terms of pain or the other things that we can use it for. It, whether it's musculoskeletal um, or central nervous system related pain,
Hmm.
acupuncture needles have the ability, and acupressure, just the acupuncture points in themselves, um, have the ability to relieve musculoskeletal pain, um, or stimulate or sedate, whichever is needed, the central nervous system to alleviate that pain. Did
And
I give a good explanation?
yes, yes. Um, also, because there are always a lot of questions behind acupuncture and the way that it works and the different ways you can do or get pain relief. Um, how could you help someone who knows nothing about having acupuncture done, um, to easily explain it to a family member that might be suffering from pain that's hearing this webinar?
Well, to be honest, I'll say, especially since I believe I'm speaking to a certain demographic community, right? Um, I definitely understand how difficult it is to explain or bring people into any modality that they're not familiar with, whether it's acupuncture or mental health therapy. A lot of people are not familiar with that as well. Um, but I found that the best way to encourage someone uh, to look into it is to actually have the experience. It's very difficult to um, explain or encourage someone to um, have acupuncture, especially if they're afraid, if you have never done it before, because then they'll have someone that they trust, their opinion, telling them something. because we're in this webinar here, and people may trust our opinion because we're here to give the information. But in terms of the way that a lot of our audience may be communicating with each other, we take the word of people that we trust. So if you're trying to encourage a family member to try different modalities of medicine to alleviate their pain, the best way to do that would be to try it yourself, have a personal experience, and then be able to relay your experience to someone who trusts you in words and feelings that they can understand and relate to because they relate to you very easily.
And that is so true, especially in the medical community and when we talk to people outside of our community. And they trust not just our words, but they also trust people who have went through a situation and had a treatment of some sort, just like acupuncture. And that's one thing I tell a lot of patients where I work is that if it worked for one, try it and see how you like it, or if it worked for you. But you did touch on the mental health aspect of pain and acupuncture. And Mr. Baker, good morning.
Good morning.
I would like to ask you about the role that mental health plays in pain management. Could you tell us a little bit about that?
Yeah, so first of all, thank you for having me. Mental health plays a key role in terms of pain management because mental health impacts how we perceive ourselves. It influences our behavior. It also changes how we relate to people. It advances and alters the way we think. And it also can impinge on our romantic and marital and sexual relationships. So when you talk about mental health and pain, it is kind of all-encompassing thing that impacts almost every area of our lives, including our mobility as well.
And how would you connect to your patients as far as looking at, are they suffering from pain, physical pain, or how do you assess these patients?
Right. And so typically when people come in, I do what's called an assessment, number one. But number two, I also provide several self-assessment tools as well. I utilize what's called the PHQ-9, which is the patient health question, which helps to measure depression. Also use the GAD-7, which helps to measure generalized anxiety disorder. I use a tool called the mood questionnaire, which helps to develop some relationship if the patient is dealing with some type of bipolarism. I use the perceived stress scale and also use the PTS scale as well that has some element of pain in there. So I use a wide variety of tools to help reach out to patients so that they can articulate and talk about the reasons why they came to mental health counseling and treatment.
And do you notice that a lot of your patients, and to the both of you guys, when it comes to assessment, do you notice that a lot of your patients come with comorbid conditions that could be traced back to aggravating pain symptoms or emotional distress that can aggravate these pain symptoms? Have y'all noticed that?
I know I have, and I think in mental health we call that kind of dual diagnosis. That's where people come in with not just one situation but another. And as African Americans, one of the things that many of us struggle and are challenged with is race-based trauma. Now, although race-based trauma is not a diagnosable disorder, something that we deal with, and it is something that people rarely recognize. You know, they say statistically 20% of Americans have some type of mental health diagnosable disorder. And in lifetime, more than 50% of people will have some type of mental health condition. So therefore, mental health is certainly an ongoing pervasive process that we're dealing with.
MSB Saint?
I completely agree. Um, in my treatment of patients, many times I'll end up with a dual diagnosis as well. People will come in for, let's say, physical pain, musculoskeletal pain, that they can identify and put their finger on and point to and say it hurts here. Or someone will come in for treatment for, um, or to help moderate treatment with mental health condition, depression, anxiety, PTSD, things like that. But in my questioning, what I'll end up getting is that the person that came in for the emotional aspect of treatment, if I ask the right questions, I'll find out there is pain somewhere in their body as well. If I question the person who came in for the musculoskeletal pain and I ask the right questions, I'll find out that they have something emotional that they're going through as well, whether it's diagnosable stress, whether it is diagnosable anxiety, or they may have been diagnosed with these, or maybe they feel uncomfortable going to see a professional like Mr. Baker, even though they need services, but they end up on my table as well. So it, in my education and practice in treating patients, I see that duality every day.
And Dr. Moore, if I can just add very quickly, it's been mentioned several times about people's initial interaction with treatment. And I would say probably 50% of the people that come to my practice, they've never been to mental health counseling before. And the reason why they came to mental health counseling is because they culturally identified with me. And they felt like, maybe this individual can understand because they've been through a relatable situation, being an African American in America. But also along with that, one of the biggest things I see, Dr. Moore and Ms. Bissett, is trauma. I see a lot of trauma, in particular, a lot of physical and sexual trauma in the Black community. It amazes me how even today that the sexual trauma that people endure is still oftentimes not talked about, but it manifests itself through fatigue, poor concentration, racing heart, panic attack, and things of that nature. So again, when we dual diagnoses, there are so many people in minority communities that are dealing with a myriad of issues. And I think when they begin to feel comfortable, and like I think it was mentioned, you recognize that treatment is care and treatment is something that's allowable, and going to mental health and other services does not make you weaker, but it actually perpetuates strength in you.
And do you guys see that there's misconceptions associated with race and gender and expression of pain?
Absolutely. I can tell you, if I can just share a very quick story. My daughter goes to a university in Alabama, and long and short, she had to go to the emergency room and she had to be treated and she had to be hospitalized. When she initially came in, my wife and I told her, look, she was 20 at the time, and we told our daughter, look, keep your phone on FaceTime so that, we can kind of encourage you, because she was very scared. She was in pain, and she had never been in this type of situation, and she did not know what to do, although she was an adult by age. Of the short, she initially had one nurse to come in, and she was very accommodating, very nice, very pleasant. But then when her night nurse came in, she was just, let's say, culturally insensitive. And my daughter asked her, told her, I'm in pain. Can you give me some pain medication? And the nurse snapped at her and said, well, what do you need medicine for now? And I said, ma'am, excuse me, why are you talking to my daughter that way? She said, oh, I didn't know anyone there. So if it had not been for that measure, I guess, wisdom to be able to advocate for our daughter, then I don't know what would have happened had the situation continue without us. So that is like a real life prevalent situation that I've been through. in terms of that, and I'll say one more thing, then I'll turn it over to you, Ms. Bissett. They did a study, according to Harvard Global Health Institute, they did a study, and they found that some Caucasian doctors, they're twice as likely to underestimate African Americans' pain. And some also believe that African Americans and Hispanic Americans are more likely to ask for pain medication to abuse it. So that's very interesting to note again the misperception and misconception in terms of African Americans and pain.
I've been nodding my head the whole time, as you can see. um, I can't agree with you more. I will say that experiences like that are the reason why I am in the profession that I'm in. I've had personal experiences in the healthcare field. I'm pretty sure a lot of our audience has as well. Probably each of us has as well. Even as clinicians, we still have to go get care. And I'm pretty sure the three of us have probably had at least two uncomfortable or unprofessional experiences in the healthcare arena. When it comes down to it, as Black people, we know better than some other people how the establishment views us in terms of how we express our pain, in terms of how we express ourselves when we're trying to get care. Um, and this is why this panel with us in front of the audience is so important, so they can see that there are caregivers out there that are caring, and we are here for them. We also are listening. And one thing that I want to say to patients is to don't feel uh, ashamed of expressing pain,
Yep.
whether it is physical or psychological or a combination of both. Because I I feel because we have been taught culturally to move through the pain. A lot of times we've had to, for survival reasons, economic reasons, still have to go to work when you're in pain in these type of examples. We've gotten used to not expressing how in pain we are. So then when we do go to the establishment and we're in conditions like your daughter is, a lot of times people are not used to seeing us express pain. They've been desensitized to Black and
Exactly.
brown people expressing pain. So when we are, they're taught to put a shield up because they're not used to viewing our pain and humanity in the same way. So we need to also learn how to express pain, learn how to tell our practitioners that are there to care for us how and when and why if we know that we're in pain. Because people, when we are in pain, people get so shell shocked because we're doubled over that a lot of times nobody knows what to do when they've trained to help people in terms of knowing what to do. But for some reason, when it comes to Black people's pain, it's very difficult for a lot of people to navigate our emotions and how we express and what we need in return.
Dr. quickly just say, that's so true. And we've seen that play out through with professional athletes as well. We've had a lot of professional athletes have had to act for themselves because they were in pain, but they were trying to be pushed to go in to play their sport that they were really injured by. I was trying to think of the gymnast, and I see her on the Subway commercials. I can't think of her name now, but she, you know what? Emotionally, I'm not there. Emotionally, not connected. So I need not to do this event. So she literally, during the Olympics, she said, you know what? I'm not going to do this event. But when she came back, she got a bronze medal. We had another tennis professional as well, young lady, who said, you know what? My mental health is more important than playing a tennis match. And she pulled out of some matches. So I think, again, the fact that we've been told so many times to push through, but not allowing our bodies to heal, I think that's a key component in terms of being able to advocate for ourselves and to speak up when we are in pain. And lastly, Dr. Moore, I say this: how we express pain may be different from other people. I know, like for my wife, for instance, she has chronic back pain, but she's not one to grimace or whine or really show a lot of facial and emotionality when she's in pain. Contrast that to someone else who may be very emotional, and they just may be built that way. Some physicians may take my wife and say, well, you couldn't be in that much pain because see it. But then on the other hand, someone that's more expressive, they could say that they're overly dramatic. So I think, again, we just have to be consistent, and we have to continue to advocate for ourselves to deal with the misconceptionality that we have in our community.
And I believe also as practitioners is that we have to also be cognizant of the different cultures that's out there and how they express pain. And we can't just push aside because she doesn't grimace or this person is screaming that her pain is not like her pain or his pain. Mm-hmm. And one reason I went into the pain fellowship is because I believe it takes a team. Mental health, or integrative medicine, Western medicine, acute care. It takes a team to treat pain patients, people in pain. We have to look through and feel through all the darkness that can be covering up what's really going on. And I really noticed that a lot of patients that I encounter, when you're doing that assessment, like you guys were saying, that it's a dual issue. It's not just I hurt, I'm in pain, I'm doubling over. It's a issue. When we talk about pain, we also state the fact that pain is something going wrong. There is an issue with the body, the mind. Something is wrong. And it's not a one size fit all. It's not a magic pill. It's not a magic potion. It's none of those. It's a conglomerate of everything that has to be used to find out what's going on. And that's what I see daily, just like you guys described. We all express it in different ways. We all have to interpret it in different ways. We have to understand it in different ways. But we have to be open to allow these patients to come to us to say, I hurt. I don't understand why. Or I stumped my toe. Is there additional methods instead of just giving a pill? And also you deal with patients who have a history of abuse, drug abuse, substance abuse, and they don't want that pill, that medicine. They want something different. And I'm so glad to have you guys here today to be able to explain that, there are different treatment options. Acupuncture to help with chronic and acute pain. Also, I've heard of different options in mental health. I'm not a mental health provider to that sense, but Mr. Baker, are there other things that are out there that can help with treatments of pain?
Sure, absolutely. And before it was Simone Biles was the Olympian that dropped out. She took a break and then she came back for her mental health. And now Naomi Osaka, she was the tennis sensation that dropped out for her mental health as well. So I just wanted to say those names. So yes, there are a few treatments. You have what's called acceptance and commitment therapy. And with acceptance and commitment therapy, it basically gives the patient permission to accept their hardships, but then getting trained how to move through it in a more beneficial way. There's also what's called biofeedback, as to where patients are connected to a sensor that helps their body to receive, so that patients can make subtle changes to deal with situations in terms of reducing pain. You also have mindfulness treatment, and mindfulness is basically the ability to stay fully present and aware of your current circumstances, but being able to move through them more effectively. There's cognitive behavior therapy, which teaches patients to basically interact with their mind and their behavior in a more efficient way. And then, according to Dr. Christina Puchinski, she's the director of George Washington's Institute for Spirituality and Health. She says that the number one non-medication relief of chronic is prayer. She said prayer is the number one relief for chronic. I found the interesting definition of prayer that I think is befitting for, if regardless of if you are a Christian, Muslim, Buddhist, whether you're agnostic, atheist, and that definition is this: prayer is the act of asking for a favor, and particularly with earnestness. Prayer is the act of asking for a favor, and particularly with earnestness. Now, everyone, regardless of your religious belief system or your background, has needed a favor from time to time. And so one of the things that prayer does is it puts you in position to ask your belief system or your creator for a favor to help you reduce the pain and challenges that you're dealing with. But those are some of the treatment modalities that helps to relieve chronic pain and challenges in that area.
And Ms. B. Saint, I wanted to ask you also, I know with your degree set and you're dealing with Oriental medicine, but just briefly, if you could tell us about herbal medications or herbal treatments, because in many communities, we all use some type of herbs to help with blood pressure or heartburn, indigestion, things of that nature. What are some things you would like to tell the audience, especially with using herbs, and the benefits or non-benefits of using?
The first thing that I'd like to say to everyone is be extremely, extremely careful when utilizing herbs. All medications have been developed from either a herbal source, a mineral source, or an animal source. So all of the medications that we use have been developed from the basis of some natural source. So we have to be very mindful when using them because they are extremely powerful. And just because something is easily accessible does not mean it's safe. Many herbs people can look up online and order online and get them. I don't want to discourage people from using herbs, but what I do want people to think about is that, especially in the African American and Black communities, a lot of us grew up with people in our families, especially women, who use different herbal remedies to get things accomplished. And a lot of times those things were passed down in a way that we would like to utilize. But just like any recipe, grandma knew how much she was putting. Even though it looked like she was just grabbing and picking from here and there, she knew exactly how much she was using. And sometimes we, as Black people, because we want to be closer to our culture, right, of herbalism and natural medicine, we pick and grab as well. And I want to discourage people against that, because when you start picking and using things, combining things, using herbs that you're not necessarily as educated in as maybe someone who's been studying as long as I have, or as your grandmothers or aunts are, please seek out um, herbalists. There are herbalists who prescribe herbal formulas just like doctors prescribe medication. They are certified to do so, and they have malpractice insurance as well. So when it comes down to it, you want to uh, hold your herbalists and other people that you seek out more traditional modalities from to as high a standard as you would hold professionals who, or medical professionals who have a certain type of license, like Dr. Moore or Mr. Baker, because they have a responsibility to you as well. And just because what they're giving you is natural does not mean that they don't know that there are maybe side effects or maybe um, coinciding effects that they're knowledgeable about, that they can inform you of, and say, "Hey, I'm giving you this herbal prescription for this. Look out for these things. Notify me if there's any A, B, C, or D." But herbalists are as serious about our herbalism as um, let's say an anesthesiologist would be about their dosing in terms of medication. So I just want to encourage people to be mindful about who they're sussing their herbs from. Don't Google a whole lot of stuff and order things online that you may not be as educated about. Some qualities of herbs are different as well, so you really don't know what you're getting unless you have been trained to suss out quality. So I just want to encourage people to continue seeking alternative options that may not be pharmaceutical if you don't need it. But I also want people to be wary about treating themselves with herbs when they may not have as much knowledge as needed to be safe.
Okay. And Mr. Baker, anything you would like to add?
Yeah, I just want to encourage people just to continue to advocate for yourself. I developed a quick acronym, and I wanted to share very quickly, called DAPS, and hopefully this will encourage someone. So DAPS is depression, anxiety, paranoia, and self-pity. So it's depression versus determination. So depression, of course, wants to keep you smothered, keep you down, keep you limited. But when you use your determination, you become active, engaging. And I want to encourage people too to develop a playlist. One of the things that helps to lift depression, I know my depression, when I feel depressed, because everyone feels depressed from time to time, is a playlist to have those songs on there. Number two, I talked about anxiety, and it's anxiety versus accessibility. So when I say accessibility, I mean to advocate for yourself, continue to link up to people and organizations that are helpful, continue to coordinate self-care in your life that's going to be beneficial. The P in DAPS is for paranoia. Now, paranoia can take the form of you being defensive, hostile, aggressive, or being easily offended. But the perversity of that, I believe, is being powered. Being powered. And what I mean by being powered is being able to remember the strength that you have, being able to remember the resources that you have access to, and being able to connect with people that help you to feel better, do better, so that you can ultimately be better. And the last thing is the S, which is self-pity. Sometimes when you're dealing with chronic pain, you can fall into self-pity. But what I have is self-pity versus self-perception. Now, when I say self-perception, I'm referring to things that you do on a daily basis that helps to relieve the challenges. So pain has a schedule every day. So I believe in terms of you to redefine yourself, you have to have a schedule every day for yourself to help build you up, to motivate you, and to encourage you. And one thing that I often tell people is this: if you aim too low to go, but if you aim higher, you will reach your desire. That's my last word for people.
Coder the carrier.
Huge headaches.
Bicycle accident.
Sickle beta thalassemia.
Rheumatoid arthritis.
I got hurt trying to break up gang fights.
2 brain injuries within 5 months.
Chronic pain. Until you deal with it, you really don't understand it.
There's so much misinformation that has come out about pain.
I don't want the pity party. That's not what I'm looking for, but I want people to know that what you see may not be what you get.
We isolate. We are depressed. We don't talk to people because they don't understand. We cancel plans because we don't want to ruin somebody's day.
There are a lot of people who are in constant pain, who are not just faking it, trying to get prescription drugs.
They may be a husband, a wife, father, son, brother, sister.
These are your colleagues, your neighbors and friends. You may not even know their stories. It has a huge impact on their lives.
I want to encourage other people. I want people to know to keep trying so that you can live each day to the fullest.
Look at me, judge me all you want. Walk in my shoes. I wouldn't wish the pain on you.
Can you imagine waking up every single day of your life and vomiting because you had such a huge headache? And that basically has been my life for the better part of a decade.
I call them suicidal headaches. The pain was worse than anything I've ever felt before. I would call my parents at work and tell them that I wanted to commit suicide because it was so horribly bad.
It's a level of pain that is so intense you can't sleep, you can't sit, it's hard to stand, it just hurts to move.
Imagine your worst toothache you've ever had, and then imagine that dentist trying to extract that tooth with no deadening at all.
If I'm out in the cold, I'll get hives anywhere that gets cold too long. It's like a hurt and a burn and a sting and an itch. I used to say, I'm allergic to the cold because I didn't know any other words for it.
When the pain was there, it was so sharp and acute right here that you'd be stabbing yourself here really hard to try and get rid of that pain.
Sometimes I can't lift either arm. It might happen at 3 in the morning, it'll just hurt. Just like a throb, but a throb that just stays there.
Nothing that I tried to do to cope with the pain worked.
My whole life has been trial and error. I mean, there's nothing in the books that says, do this and it actually works.
I've tried a lot of different things to try to get rid of the pain. It's just kind of my constant companion.
I'm through asking the doctors, am I ever gonna be back to normal? It's like, what's normal, you know? And now I'm just trying to adapt.
I had little faith in the medical system to spend the resources and time necessary to diagnose what was wrong with me.
I try not to talk about it. I certainly don't want people to think that I can't function because of it, and because I can. It's just I have to pace myself.
All you want, basically, is to have a pill, regardless of what that pill is, even if it was going to kill you, that's going to take that pain away.
All right, so I want to thank you both for joining me on this webinar this morning. Pain is a complex issue. It's complex to treat, but I thank you both for coming on this morning and giving your insight on what you see, what you deal with, how you react with patients dealing with pain, to see that it's just not something that hurts, but it's a conglomerate of things that are also entailed with pain, the emotional connection. the physical connection to pain. I see chronic pain, or just pain in general, presents broad challenges, especially for just assessment. And pain is so subjective in nature that it can be difficult to understand what that person is going through. And I thank you again this morning for joining us and for allowing us to tell you our perspective, our education, what we know about pain, how we deal with it, and to also understand that it's no shame to say that you're in pain. It's no shame to come to the professionals to seek help. We're here for you. And if there's any questions, please feel free to reach out to us. I also want to thank our sponsor, AARP, for sponsoring this webinar this morning. And I thank everyone today. Have a great day.